Hey everybody, it's Dr. David, the ENT doctor. I want to talk to you about a condition called atrial fibrillation, which is a heart or cardiac condition, which is an irregular heart rate, where one part of the heart is beating faster than another. And the reason that I want to bring this topic up is that I was lucky enough to meet a nurse that works in a cardiac clinic who was aware that on having conversations with the patients that they were having problems with their breathing and sleep at night. And then when she started looking into this some more and asking some more and telling it, she found that 90% of the patients turning up with this atrial fibrillation were having problems with their breathing and sleep. And what was worrying for her was that there didn't seem to be any specific recommendation about these patients having an ENT assessment and also having a sleep study. And that's a shame because the research shows that patients with AF or atrial fibrillation, one of, if not the most common underlying causes, disease processes that may well be driving the disease condition is obstructive sleep apnea. So what I would like to suggest for people that have been diagnosed with AF, or if you know someone that's been diagnosed with AF, if that person is snoring or mouth breathing, if they are obviously stopping breathing at night, and no one is really paying attention to that side of their health, that they definitely go and see an ENT, and then that ENT can make a physical assessment of the airway, discuss the underlying causes of any airway obstruction that may be identified, and then building on that, obviously getting the involvement of sleep physicians and so forth where appropriate too. So please, as I keep saying, don't ignore the snore, and please be proactive. We want to have an approach where we are holistic with regards to managing all patient problems, and atrial fibrillation and obstructive sleep apnea, pardon the pun, are definitely bedfellows. Cheers.